Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. A cancer diagnosis changes absolutely everything. While active treatments like chemotherapy and radiation are life-saving, their side effects can be brutal. Today, we're discussing how Pennsylvania's medical cannabis program supports cancer patients.
This is one of the most critical conditions we address at PennsylvaniaMarijuanaCards.com. Cancer was one of the original qualifying conditions in 2016, and the law is remarkably broad. It covers any cancer at any stage, and it includes a very specific phrase that most people overlook, including remission therapy.
That phrase, remission therapy, is huge. What does that mean legally and clinically for a patient who technically finished their treatments months or even years ago?
It means your legal access to medical cannabis doesn't end when your tumors are gone. Studies show that nearly half of chemotherapy patients still suffer from painful peripheral neuropathy 6 years after treatment. The state explicitly recognizes that the long-term burden of nerve damage, chronic fatigue, and fear of recurrence qualifies you for a card even during full remission.
That is incredibly compassionate legal design. Now, let's look at the actual clinical data, because expectations need to be honest. A lot of patients hope cannabis can shrink tumors directly, but the 2024 guidelines from the American Society of Clinical Oncology say otherwise, right?
Exactly. The data simply doesn't support cannabis as a direct anti-cancer or tumor-reducing treatment in humans yet. Where cannabis truly shines is in symptom palliation. The 2024 ASCO guidelines and the 2024 Remission randomized controlled trial proved that adding balanced THC to CBD formulations provides massive, statistically significant relief for refractory nausea when standard anti-vomiting drugs fail.
So it's a powerful second-line defense for severe nausea. What about managing severe cancer pain? Many patients are already on heavy prescription opioid regimens. Cannabis shouldn't be viewed as a standalone replacement for opioids in moderate to severe cancer pain. Instead, clinical data shows it functions beautifully as an opioid-sparing adjunct. By introducing a balanced one-to-one product, patients can often lower their opioid doses, which directly reduces side effects like heavy sedation and severe constipation. Now, your guide includes a massive warning that almost every other medical marijuana website completely ignores. It has to do with immunotherapy drugs like Keytruda or Opdivo. Why is this critical?
This is arguably the most important safety info on our site. Immunotherapy works by hyperactivating your immune system to attack cancer cells. However, cannabis has natural immunosuppressive properties. There is an unresolved scientific concern that cannabis might accidentally counter the efficacy of immunotherapy. The National Cancer Institute just launched a $3.2 million study to get definitive answers. If you are on an immunotherapy drug, you must consult your oncologist before using cannabis.
Wow, thank you for putting safety first. That highlights why checking drug interactions is so vital. Your guide notes that CBD can also interfere with the liver enzymes processing standard chemotherapies and blood thinners.
Yes, CBD can inhibit liver enzymes like CYP3A4, which can dangerously elevate the plasma levels of certain chemotherapy medications and opioids in your bloodstream. It is not an automatic disqualifier, but it means you absolutely must bring a complete, current medication list to your evaluation so our doctors can review it safely.
Perfect. So if a patient in active treatment or a survivor in remission wants to safely secure their card through your platform, what does that path look like?
We keep it completely stress-free. Step 1 is filling out our 3-minute online intake form at PennsylvaniaMarijuanaCards.com. Step 2 is the telehealth evaluation from the comfort of your home. You'll speak directly with an expert registered physician, like Dr. Jonathan Chance Miller, whose official NPI credentials are fully transparent and listed on our site.
And if for any clinical reason our medical team determines that cannabis isn't a safe fit alongside their current chemotherapy or immunotherapy regimen, they don't lose any money, correct?
Correct. If our physicians find that you don't qualify or that it isn't safe for your specific regimen, your $159 fee is completely and instantly refunded. If you are approved, Step 3 is automatic. We submit the state certification the exact same day. If you suffer from severe fatigue, you can easily designate a caregiver to handle all dispensary visits for you.
Risk-free, highly transparent, and deeply protective of patient health. A perfect resource for anyone navigating the complexities of cancer care.
Absolutely. If you are ready to explore medically guided symptom relief for active treatment or post-cancer remission, head over to PennsylvaniaMarijuanaCards.com. Fill out the form at the top of our page and let our compassionate medical team handle the rest.
Book your telehealth visit today at PennsylvaniaMarijuanaCards.com. Thank you for listening, and take care.